is your Solent journalism update at 3 o'clock. I'm Holly Busby. Hampshire health bosses have introduced a nationwide NHS smoke-free pregnancy campaign to encourage pregnant women to stop smoking. The programme will highlight the dangers to unborn babies, including a lack of oxygen, premature birthing, and the risk of developing asthma later in life. Experts say that pregnant women might keep their habit a secret to avoid social stigma. And our reporter Nancy Ashcroft is in studio with me now. Nancy, what else is being done to help people quit?
So, the government would like the whole of the UK to be a smoke-free country by 2030, and they said they're going to do this by encouraging people to either quit outright or move to lower-risk alternatives like e-cigarettes. They're going to do this by implementing help to quit for every patient who gets admitted to hospital who smokes. However, cuts by the Conservative Party to the NHS have reduced spending on quitting services by 30% since 2014, and only half of local authorities can offer help to quit smoking. Currently, there are no plans to force a levy on tobacco companies in order to make up for this deficit in funding, which has left some campaigners for quitting smoking, such as Cancer Research, unhappy with the schedule.
So what do you think the benefits are to giving up?
Oh, there are numerous documented benefits to reduced smoking rates, but the largest one, the most obvious overarching one, is that reduced rates of smoking equal reduced health inequality. So people who are more vulnerable in society are much more likely to smoke. So, for instance, in Blackpool, 1 in 4 pregnant women smoke, whereas in Westminster, only 1 in 50 pregnant women smoke. So when less people smoke, there is less disparity between the health of those who are poorer and the health of those who are richer. But for the individual smoker, the average smoker would save £141 a month, which adds up to almost £1,700 a year just from quitting smoking. And as a timeline, after 48 hours of not smoking, there is no nicotine left in your system. After 3 to 9 months, you can have up to 10% increased lung function. After a year, your risk of heart disease is halved. After 10 years, your risk of lung cancer is halved. And after 15 years, the risk of you having a heart attack is down to the same level as somebody who'd never smoked.
Thank you, Nancy. With today being World Mental Health Day, organisations are being urged to think about the mental well-being of their staff. We spoke to Dave Shields, Cabinet Member for a Healthier and Safer City, about how budgets have affected mental health support in the city.
Well, first of all, it's nice when we get given money, but you then have to look at how much money has been taken away over the last 10 years. And quite a lot of money has been taken away from councils for things like youth services. A lot of the mental health preventative services, outreach have gone. So when we get some money back for one-off things, it's nice, but it's actually trying to sort of make up for what's already been taken away. And the other thing is that we need to, excuse the expression, differentiate between specialist targeted services and universal prevention services. So universal is something that's basically there as a nice safety net where people can go rather than wait to someone develop a crisis. And that sometimes can be too late. If someone reaches a crisis, they then might do something. You can sometimes intervene, but ideally you really want to be intervening earlier and sooner.
Figures from the NHS show that patients with learning disabilities and autism are being physically restrained. This practice has been known to kill in as little as 10 minutes. This restrictive intervention should only be used as a last resort, according to the guidance set out by the government. Meanwhile, My Journey Southampton has created a series of walking challenges to show how staying active helps mental health. The NHS programme is focusing on 5 steps that will aid the community in being more active. The steps include walking to work instead of driving, or getting off the bus a few stops earlier to maximise fitness. Our reporter, Alex Daniel, spoke to residents of Southampton about how often they walk.
I find it necessary to come for a walk because of the fresh air and also to walk. So how many steps a week do you think you do on average?
100,000.
100,000 a week. And then what kind of activities are you usually doing when you walk? Are you going to like the shops or to the gym, things like that?
We're walking mostly to walk.
The next phase of work is continuing in the city on a new Copenhagen-style cycle path. The planned route will start on the avenue and lead to Northlands Road near Southampton Common. The £1.3 million project will focus on creating segregated on- and off-road cycle lanes. The construction is one of many new cycle lanes created across the city as part of the Southampton Cycle Network. This comes as the council have launched a Green City Charter aiming to tackle air pollution in the area. And finally, a survey has found that salaries for new jobs in Southampton are up by 10%. The study by Job Board Research CV also found that average salaries in the city are just over £35,000 per year. That's all from us for now. You can find all our stories and more at solentjournalism.co.uk. Please tune in to our final video bulletin of the day at 3:30. Goodbye.